Have you struggled with back pain for months or years and been frustrated by the process of getting a diagnosis from your doctor or even a treatment plan that seems to have any hope of working? If any of that sounds familiar, then you're going to want to listen to this episode because we're going to be talking about why back pain treatments fail and 2 things that you can do to help yourself get out of back pain for the long term. Hey everybody, it's Matt Shu from Upright Health and welcome back to the Upright Health Podcast. In today's episode, we're talking about back pain because we've been working on the Back Pain Fix program for the last several months, and that is now live and published and ready to help people with back pain around the world. So if you have back pain and you're looking for a corrective exercise program to help you gradually and safely retrain your whole body so that your back feels better, then be sure to go to uprighthealth.com/backfix. Again, it's uprighthealth.com/backfix. Now, all that work on that program made me want to do a quick podcast episode on why back pain treatments fail. If you listened back a few months ago, I actually interviewed Catherine Jacobson Raymond, a journalist and New York Times bestselling author of a book on back pain that I still highly recommend. It's called Crooked: Outwitting the Back Pain Industry. Well worth a read as it chronicles some of the incredible deceptions and irresponsible things that get foisted on the unwitting public to treat back pain. Definitely worth a read. It is scary what treatments the medical industry will push on patients, how invasive and how harmful some of these things are to people. And that book just dives really deep into some events that will literally make your jaw drop. So again, Crooked: Outwitting the Back Pain Industry is a highly, highly recommended book. You've got to read it if you are suffering with back pain. It also has some very clear, specific things to tell you about what to do about back pain, which dovetails exactly with what we're going to talk about today. So let's talk about back pain treatments and why they fail. In its most simple, fundamental essence, the reason back pain treatments fail is because the medical system, the way a lot of health practitioners and healers view back pain is flawed. It's fundamentally flawed. It's obsessed with one structure at a time. So what do I mean by that? What I mean is if you go to see a medical doctor, many times, the vast majority of times, if you say your back hurts, they're going to be looking at your back. They will look at your spine. They will look at the structures of your spine. They will look at the muscles around the spine. They will look for the discs within the spine. They will look for anything right around the spot you are complaining about to find the cause. And I use air quotes there because I don't think what they find as the cause is the cause, but they'll look for the cause of your back pain right where you're saying your back hurts. And they'll do that in a way that I think obsessive is the best way to put it. They'll look as close as they can and as deeply as they can for that sign of something wrong right there. They'll use x-rays, MRIs, maybe they will do some sort of strength test or, a flexibility test or something. And they'll say, well, these bones are too close together, these bones are degenerated, these discs are a little bit too big in this position, this disc is a little too flat. They'll say, oh, maybe it's because this disc is pushing on a nerve, or maybe this hole that the nerve goes through is too small. There's all these different possible diagnoses. And the reality of all these medical diagnoses is that the relationship between these structural deformities or abnormalities, again, air quotes, the relationship between those things and actual symptoms is not there. There's basically little to no demonstrated correlation between those abnormalities and pathologies, again, air quotes, and symptoms. Meaning those things don't appear to be related to pain, but that's what doctors will tend to be obsessed about. Now, you might go to see a massage therapist or a physical therapist or a chiropractor, and they might take another viewpoint and say like, okay, well, it's not the bones and it's not the discs necessarily. Well, let's back this up. If you go to see a chiropractor, a lot of times they will say it is the bones, right? They'll say the bone position is wrong and we just need to pop some things in place. If you see a massage therapist, they'll actually, usually won't be looking at your bones, and they'll just say, well, these muscles are super tight. I just need to soften your back, soften these back muscles so your body doesn't feel so bad. If you see a physical therapist, sometimes they'll do the individual muscle obsession, right? They'll say, it's just your multifidus. They'll say it's because your transversus abdominis is too weak, right? They'll get really zeroed in again, whether it's a PT or a massage therapist or a chiropractor. There's this very human tendency to just zoom in on the one thing that you think if you treat, it will make everything better, right? It makes intuitive sense, right? It feels right. Like, okay, it hurts there, the problem's probably there, so let's just go there. So when you as a back pain sufferer are then looking for help, you get caught up in this same mode of thinking. You're thinking, well, if it's my lower back that hurts, there's a lower back problem, and everybody you talk to is following that same obsessive path, zooming in, zooming in, zooming in. And this is why back pain treatments fail. It's because the zooming in is getting too extreme. It's like trying to get down to a microscopic level, right? The pain's right here, the problem's right here. I just have to look hard enough at this one place, and eventually I'll find the cause and I'll fix that problem. The reality that we see with the clients we've worked with over the years is that back pain is not about just the one spot. It's not just about the one muscle. It's not just about the relationship between two bones. And when you look at all the medical research over the years, you can see that coming out, right? You see that, the bone shapes, the pathologies, the positions of the bones, they're really not that big a deal. They don't seem to actually be a one-to-one correlation with pain, right? If there were any strong correlation, all these studies would have shown it, but those correlations don't show up. And then, you can see with massage, sometimes it does work, sometimes it doesn't. With PTs, sometimes it does work, sometimes it doesn't. There's a great deal of variance with all these approaches, and I think the best explanation there is that sometimes these things do address a piece of the puzzle that's important, but they often are losing sight of the whole picture because of this obsessive zooming in. So, when you then try to treat these tiny little things that you're seeing or looking for, you're doomed to fail. Most of the time, at least 50% of the time, you're going to fail because, hey, you missed the big picture, right? This is like saying, okay, my car is having some sort of problem. I'm going to take it to an auto shop that only specializes in brakes, right? And they're going to look at my brakes and they're going to look harder and harder at my brakes to try to figure out why I've got a warning light on my dashboard. And they're going to look at my brakes so hard, they're going to replace the rotors, they're going to replace the brake pads, they're going to do all sorts of fine tuning, and still I have that warning light on my dashboard because the problem doesn't necessarily have to be with my brake pads, right? So maybe I take my car to somebody who specializes in dashboards, and they look and they see, well, yeah, you do have a warning light on there. What we can do is just, unplug that warning light. Did that really fix my problem? No, it really did not. if you're just focused in on one specific location or one little spot, you're going to miss the big picture, and your treatment, your solution is going to be incomplete. So, what can you do about this? There's two things to think about when you've got back pain and you're caught in this cycle of, looking for this detailed answer, right? Looking for this answer that's supposed to be right here in this one spot in my back. The first thing you have to do is zoom out. You need to assess your whole body. That's something that we talk about in the back pain fix. That's the basic structure of the program, is to look at everything else also, right? Yes, your back matters. Yes, your back muscles matter. Yes, the position of some things in your spine matter. And also, you need to see how the rest of the body functions. Are you able to touch your toes? Because if you're not, when you go through a normal day and you try to do something that requires you to get to that position, and your back has to compensate and your back muscles don't know how to handle that load, then you're going to run into trouble, right? If you have muscles in your legs or around your hip joints that are really stiff or are really weak, that is going to affect your ability to do daily life without pain. Your back muscles may compensate. Your hip muscles may compensate. Different ranges of motion may get lost because your body is not strong enough, is not flexible enough, etc. So the solution isn't just to look at the back, it's to look at how everything in your body affects your back and how your back affects everything else in your body. It's not just a linear, A and B, it's A affecting B and B affecting A, right? It's a non-linear system. So, step one, zoom out, look at everything. I know that's overwhelming, but that's why we made a program like the Back Pain Fix, so you can do that in a more systematic way and in a gradual way. I definitely don't suggest that you try to fix 100 different things all at once, right? You want to go step by step, kind of look at different parts of your body and then improve your control and get things moving correctly. Okay, so that brings us to step 2, which is to move more and with more control. So when I say move more, I'm really not saying that everybody should go out and do high intensity interval training. I'm not saying you should go out and do CrossFit. I'm not saying you should go do a boot camp and spend 45 to 60 minutes moving as hard and as fast as you can. What I am saying is that you should be integrating more movement in your day, and you should be trying to do that with more and more refined control. So you're not just moving swiftly and sloppily, but rather you're moving in ways that you are fully controlling. So when we're working with clients, and we talk about this at our workshops too, when you move, you want your movements to be clean. You want every part of a movement to be under your conscious control. So you don't have your body deciding that your body, a certain body part is moving at a certain direction that you don't want it to. So the classic example of this for people is trying to go down into a squat. If you try to squat with your butt going down to the floor, a lot of people will notice that their knees want to just fly out to the sides, or they notice that their back will curl as they go down and they can't quite get the butt to go as far as they want, so the whole upper body folds forward and then the upper back curls into a C curve. Those are motions that are happening outside of your conscious control. That's not a clean movement. You want to be able to isolate out what you want to move, right? So if you're going down into a squat, you want your hips to be bending, you want your knees to be bending, but you want your spine to be doing what you tell it to. You want your shoulders to do what you tell them to do. Another example is when you're just standing and you want to lift your knee towards your chest. A lot of people will notice that the leg turns out, right? That's another example of a not clean motion, right? You want to be able to control the motion the whole way through in exactly the way you want it to go. And that extends out into more complicated motions. You're going into the kitchen, you're reaching to the top shelf. When you reach up with your arm, are you able to just move your arm without your head and neck craning forward, without your lower back going into a big arch and compensating for a lack of flexibility? These are all things that show up regularly, but which we tend to ignore. We're generally taught that these are not things worth worrying about. These are not things that we should think about. But the reality is, how you move is a huge contributor to how you feel. How you can move is a huge contributor to how you feel. So when you're moving around sloppily and you're just moving unconsciously, compensating around your body's issues, you're basically just waiting for something to give up, right? You're waiting for a muscle group somewhere to just say, we've had enough, let's stop. So the process of getting out of back pain is not about just like hoping it's going to go away and moving a whole bunch and hoping that your back just loosens up. The process that is the most productive in my mind is to engage in a learning process of understanding what your body can do, what you want it to be able to do, what it should be able to do, and then gradually moving in that direction, right? So that is what I mean by move more and with more control. Start with basics and then get into more complicated things over time as your body is prepared. Nobody ever says you should go and lift 600 pounds off the floor next week. It's not practical, it's not doable. And it's an obvious concrete example of what your body can progressively do over time if trained safely. There are plenty of human beings out there who can lift a whole lot of weight because they've trained at it for years and years and years and years. When you look at gymnasts, when you look at acrobats, these are human beings who have trained their skills, strength, flexibility over years and years and years and years to be able to do these complicated motions at high velocity sometimes. That shows you what is possible. But you cannot take a body that is completely unprepared and say, go do those things, because what's going to happen is you get hurt. You're just not prepared. But, you as somebody who's sitting in an office chair for 8 hours a day, if you start integrating in more movement that helps your body move better, that helps your body feel better, then you move one little increment closer to that acrobatic level. You move one increment closer to that athletic level that you want to have. You don't get to the acrobatic or athletic level by just trying to do those things, right? If you just sloppily try to do those things, you're going to run into trouble. Right? You're going to hurt yourself. You don't learn skydiving by strapping a parachute to your back and then just jumping out of a plane. You have to learn the basics. You have to learn how to pack your chute. You have to understand safety. You need to know how to do all the basics before you go do the more advanced thing. So that's the attitude you need to take when you're thinking about your body and back pain, or your body and hip pain, or your body and shoulder pain, right? All those things are the same, right? You need to learn to get your body in balance and train it to move more and with more control. Okay, guys, so that is the idea behind really all of our programs, right? The back pain fix is based on this fundamental idea. You have to systematically train your body to be stronger, and then you can start getting it to do the more fun, creative stuff. So if you have back pain, I highly recommend you check out the back pain fix. I highly recommend you check out the book Crooked that I mentioned in the beginning of the episode. We'll have links in the show notes. If you're interested in the back pain fix, check it out at uprighthealth.com/backfix, and you will see the whole system that we've laid out for you. As always, if you want free videos to help you with your body, be sure to check us out on YouTube at youtube.com/uprighthealth and all of our other do-it-yourself programs at uprighthealth.com/DIY. I hope you remember to zoom out, look at your whole body, move more and with more control, and as always, remember that pain sucks. Life shouldn't.